So we're going to shift gears now and look at the other end of what we do. We started out this morning saying we're the scientists who set our line of sight toward discovering and developing medicines for patients. And we have the opportunity today to speak with somebody who's been on one of our trials with one of our molecules, two of our molecules actually, the BRAF and MEK inhibitors. And I'd like to welcome John. I'm going to refer to you as John, if that's okay.
Sure.
And first offer my gratitude to you and your wife Mary and niece Deirdre for coming here. John flew here from Colorado to meet with us. So I want to thank you for that. I know it could be a little daunting in front of this big audience, but we'll just speak and make like they're not there.
Okay.
So, just starting out, could you just tell us a little bit about yourself, John?
Well, I was born and raised in Colorado, and I met my wife there in Colorado. We've been married 45 years, raised our family. I have 5 grandchildren. We have 5 grandchildren, and I retired from the law about 12 years ago. It changed, I didn't, and it wasn't pursuing happiness, and so I retired, and my life was fine, basically predictable, and I kept getting bumps on my back and irritants, and I'd go to the dermatologist, and he'd say, oh, it's just a cyst, don't irritate it, and that's that. And finally, his medicine or his skin rub didn't work, and I was itching all the time. And finally, he had me put on Crisco, and sure enough, the Crisco worked, but the high-priced skin, yeah, it moistens
oil.
Oil, cooking oil, chicken frying stuff. And so that's what he did for me, as far as I know. He did get rid of all the unpleasantness, but the cysts kept coming back, and I'd go back and pester him. And that went on for a while, and then I had a heck of a pain in my hip. And I'm a hiker, I'm a climber, and a mountain climber most of my life out there in Colorado. I've done most of the 14ers and some other hairy things, and at any rate, it was interfering.
So before then, you were in pretty good health, you were climbing mountains, you were really out there and doing fine.
At age 63, I could gain 1,000 feet an hour, not with a backpack, just a summit pack, but that's a 100-story fire escape, and I could make it in an hour and do the next 1,000 feet, you know, and maybe I could do 3,000 feet without really straining myself. So I think I was in good shape. I felt wonderful. She keeps me great. She told me I had already drank my share of alcohol when I was 27, and I was moving in on somebody else's. So in great measure, I followed her advice. That's all.
So you were telling us that then you started having all these lesions and you were treating it with Cisco and it was starting to get better, and then you started telling us that things started progressing a little more for you.
Well, they did. My hip hurt a lot, and I went to an orthopedic, and he took an x-ray and said, you've got sciatica and it'll go away 3-6 months. And he was right, it did, but not the dull ache. And mountain climbers fall down occasionally, and I fell in my hip, and it really hurt. Something was the matter, and I knew it. And so I went and demanded that something be done for my hip with my regular physician, not the orthopedic. And she sent me in for a CAT scan, and sure enough, there was almost a mass. I think she said if it's bigger than so many millimeters, it's a mass, it's no longer a tumor. And it was on the ilium, the arch of my hip bone. And that scared me. And I called my brother Marty Murphy, who publishes the Oncologist magazine, with his wife Ann, Deirdre's mother and father. And he sent me up to Anschutz Cancer Center to begin with, to get it typed and staged. And
that's in Colorado.
That's in Colorado, University of Colorado, a teaching hospital. And Dr. Paul Bunn, that I have a height of respect for, looked at my cysts, and he said, I want it out. And clapped his hands, and like 6 residents came in, and next thing you know, it was gone. And Mary was there. And the next thing you know, it came back melanoma. It was beyond a nevi or a nevus. And I called up that dermatologist, and he wasn't there. And I said, give me his voicemail. And so I told him that cyst was a melanoma, and I wanted him to think about something. And I said, to the mind of the fool, all things have been revealed. And that was my last contact. And then once Marty knew it was melanoma, he knew about GSK and what you were doing. And he said, get to Massachusetts General Hospital immediately.
So let me just back you up a little bit first. So you went to Colorado, you had this hip lesion after all these skin lesions. Then they did a biopsy or a section?
That was done at Massachusetts General.
Oh, so you didn't even have that. So just based on the evaluation by Dr. Bunn, he thought this was a melanoma.
That's right.
And so just tell us a little bit about that. So here's this guy, here you are, climbing thousands of feet and hiking in the mountains in completely good health, and then he tells you have melanoma.
Dr. Bunn basically told me I didn't have long, that it was 4th stage. Once they found out it was 4th stage, in Massachusetts General, they did full brain, chest, and abdominal scans, PET scans, and MRIs, and that's when they found it in my lungs. And I had marble-sized tumors in 3 of my lobes, and then the 4th one, the upper right one, had it wasn't a hockey puck. It was a handball, though. It was a big sucker. And Dr. Hornacek was standing by to be my surgeon. I mean, it was touch and go. And truthfully, I saw my life starting to end. At the time, it would progress very rapidly. I was walking on Mary's arm and with a cane. Marty had me wear a mask all the time in public, and sitting and sweating and shaking and chilling and looking for bathrooms, on your trip. And it looked like it was over to me. And so once they found out that I had 4th stage metastatic melanoma, I was open to anything, and basically just trusting my brother Marty, who's fought his own cancer. He doesn't generally tell it, but I'm so proud of him. For 21 years, he had first colon and then liver cancer, and he had a huge operation and lived. But so whatever he said, he's my older brother, and I reposed nothing but confidence in him, and that's why I'm here, actually.
So you went to just kind of follow what happened. So you went to Mass General. They did this workup.
Right.
So they did all these tests.
Oh, did they?
So you tell us a little bit about what is, we call that a metastatic workup. Could you mind telling us what that really involves a little bit?
Well, I don't know what they do to astronauts, but they did it all to me, as far as I know. And none of it was really difficult, except the lung biopsy, because I fancied cigars. I could have 2 primaries, perhaps, and they wanted to know exactly. They wanted to know exactly what I had in my lungs. And so I went through a lung biopsy, and boy, let me tell you, that'll fight off boredom. He wouldn't show me the needle at Massachusetts General, but in it goes, and you're on an ironing board back and forth into the CT scanner while he gets it lined up, and the Novocaine wears off on this side of the ribs, and then he goes through the ribs, and then he goes through the pleura, the only vacuum I understand in the body, and then pierces it real fast into the lung, and then gets it lined up, and in the middle of the tumor, he put another needle down the first needle, and you hear some snip snips, and the thing is, it's breathe. Don't hold your breath, breathe. So you have to be alert, you can't be sedated. I mean, he said he gave me a little, but I never felt anything. And time really took a long time in that thing. And then after he got it, I mean, the pathologist was right there at the arm of the surgeon, and they took the sample, and he was gone. And then they left the needle in, the big needle, and then 1, 2, 3, they flip you over on your back so you don't. And then they tell me I couldn't fly home for 6 or 8 days. I mean, it's a need-to-know basis only thing. Because little tiny air bubbles in that pleura, in between the vacuum. But he did a wonderful job. All of them did. I mean, I walk in there, MGH, I feel empowered, and privileged. So that's the only real dues I've paid to get into your human trial.
So a tumor biopsy is not exactly a blood test.
No, not at all. Yeah. It's believe me.
And the other examinations for where else the disease may have spread, it sounds like, wasn't exactly going in for a 30-second chest x-ray.
Oh, no. It took 3 hours altogether. You had to lie on your back for another couple hours, 3 hours. Then they take an x-ray to see the size of the bubbles that have to get in there. I mean, your lungs under pressure, and it shoots into the pleura the minute the needle goes through. But it was quite an experience. And then I was in this waiting period, and I was losing hope, regardless of what Marty said. Marty kept telling me, ignore anything on the internet, and wear your mask, and keep your courage, and you'll get hope. And I kind of trusted him, it was tough. And, you think of your bucket list of all the things that you have to say goodbye to, your hopes, and it vanishes, and what appears is the bucket of crap list, all the things you put off, and I couldn't leave it to my widow, what I thought was going to be my widow. And so the least amount of time you have in life, you're doing the most distasteful things, that you put off because you didn't want to deal with them. Putting in a new septic system in the house, so bucket of crap list, and so she could sell the house. She'd sell the house a long time ago if it wasn't for me. It's a big old barn. And so that's where I was while they studied my genome.
So this started, but just to put the time frame around this, so this was taking place when, these tests?
Data discovery of a tumor, October 7th of 10.
Of 2010.
Yeah, finding out that it was melanoma was like mid-October, a little later in October. And then finding out that I had 4th stage in the lungs, that took another 10 days before we got to Massachusetts General. And then there was like a 2-week period, maybe 10 days. I'm a little fuzzy on that, quite frankly. I was spinning. And finally, Dr. Bruce Chabner sent an email to Marty, and it said, Martin, we have struck gold. Your brother has the BRAF mutation, and he has V600E. And that was my ticket. You got to be dying, you got to have the right genome, and you have to be willing. Those were like the 3 requirements. And they won't let you die anything else except melanoma once you're in this study. They wanted to make sure that I was healthy and whatnot.
So you were told that you had melanoma, you had all these tests spread all over the place. And that first discussion then with the doctors there, did they offer you or describe to you what the alternatives were for you?
Oh, yeah. That radiation would turn my lungs. They blasted the hip, by the way, and that took with radiation. And that now I could walk. And so that was, fortunate. But the chemotherapy doesn't work on melanoma. And even the NCI webpage, when you look up diseases and it tells you what stage, what type of cancer, for 4th stage, right now, the NCI page says palliative therapy. And to me, that means keep them comfortable until you tuck them into hospice, And Marty kept telling me to ignore this stuff, but I was on my iPad constantly, reading everything. If somebody's out there and they want to kill you, you find out everything you can about them, and see if you can prevent it. But once I was in that program, there was a spark of hope. I think I kept the spark of hope alive, even in the lowest moments when the demons come at you. You don't want to be alone at nighttime, in that kind of a stage. And I don't know how anybody go through it unless you're in love to begin with. You think it's not worth it at times, And but at any rate, once I was admitted into that program on December the 28th in Boston, they gave me my first dosage. One little Met pill and 8 ounces of tepid water. I mean, you ask for nothing. I give you an apple, you give me back an orchard is the deal I've made with GSK. And then I take my BRAF. In those days, it was 3 pills twice a day. And so you fast an hour before, 2 hours after. 18 hours you can eat. Do whatever you want. That's all they ask. And
Really?
yeah, that's it. Twice a day, you fast an hour before and 2 hours after. And I follow it very, very closely.
So before then, what you were saying, it sounds like, though, at that point already in the fall, things were really deteriorating for you. It sounds like you were having trouble walking. Oh, yeah. You were wearing a mask. Were you having some trouble breathing?
Marty was afraid that something would attack me, some kind of get a flu, a virus, whatever. And plus, I was flying with Mary back and forth to face of North America, but to GSK a lot, and airplanes and whatnot. So he had me wear a mask. I did whatever he said. I still do when it comes to this.
And your energy then?
Well, we took the medicine on December the 28th, and then we went to Raleigh-Durham, where Marty lives, and we stayed at his house, and he cheered me the whole time and told me what a fortunate person I was, and I thought I felt better. Mary said I stopped shrinking. She could see the difference within 3 or 4 days. And I thought, he lives across in Valley Hope, or Hope Valley is where he lives. And so I thought, I'm going to go walk that golf course, the whole of it. And that was all I could really do. I was there for a week. I walked that whole golf course by the time I left. 5-6 days later, I was able to walk that whole golf course.
So this is when you're on treatment?
On treatment. December the 28th it starts. I think I'm in my 54th week.
So if we could just back up a little bit. So when the doctor at Mass General said you would be, since you had metastatic disease and you were in reasonably good shape, that you would be eligible for this trial. So could you tell us a little bit about that, about what that meant? You were asked if you would participate. Now, you're an attorney, and they gave you an informed consent form. And
I was a trial lawyer. Trial lawyers
so you didn't have to read
the
that
best
stuff.
Trial lawyers were torqued and twisted when they're kids, and the transactional lawyers had the normal upbringing, and so I wasn't going to read 31 pages, tell you the truth. But he did stress alternatives, and I could leave at any time I wanted. And I wasn't worried about that. I was worried about being kicked out, or what are the rules I have to follow. And I followed them, and now I take Protonix in case I eat too much. That's a contraindication, precaution, and warning that maybe they ought to put on. You will gain weight with this cancer treatment. Mary was cooking me the beautiful meals. I couldn't eat them I'd get a glass of milk and go upstairs and cry, actually, because of her trying so hard. I picture her with blankets and tea and anything taking care of me. But no, I just followed all the rules. You have to tell them what you take. I took 6 or 8 medications at that point in time. I've got a real writer back in Colorado, the personal physician. She wants to do something. She's a darling woman and a very good physician, I think. And now I take Protonix and I take blood pressure medicine. And I don't think I need it. I never had bad blood pressure, but she took my blood pressure right after they told me I had a tumor. So I bite them in half, and in case she's right, I take a half a pill.
And as part of this trial, are there additional things that you have to do?
Nothing.
Or are there additional
write it
tests
down.
that
Write
they-
it down. You have to write down every time you take it. They want it 12 hours apart, and I do my best. I'm within half an hour tops. of meeting the 12 hours. And it gets screwy, like, Eastern time, Mountain time, and whatnot. And so I go on GSK time, 12 hours from the time that I... But it happened rapidly. My appetite came back, my strength came back, and when you have hope, your strength will come back. They go hand in hand. And if you lose hope, your strength will disappear. And I think you need them both. And so now I think about cancer like when I take my pills, and the odd moment of the day, it's like a mangy dog looking at you all the time, and he won't leave, that cancer. And I know he's around, he's looking at me. And in a way, I feel like I'm walking on a cloud. And as long as I believe it'll hold me up, I won't sink through. But if I lost my hope, I'd fall apart. It's a personal, subjective feeling, but that's what I feel. And look what I have. It's not a hope like I hope I win the lottery. This is a demonstrable, provable reason to have hope. Here's who I was, here's what happened, here's who I am today. And I'm filled with gratitude, and I feel like a person that has been saved. And the lake I was in was so bad that I was drowning in. It was so huge, it took relays of people to save me. No one could do it. It took people behind petri dishes. It took this little bit of knowledge to be added to that. And you're all my lifesavers. And I represent, GSK wouldn't have done this if tens and tens of thousands ahead of me hadn't died. The risk-benefit to your corporation would not. So those people allowed me to be here. And I represent my cohorts, as you call them, the rest of the people in my trials. And in great measure, you keep us apart, but I'll stay later to meet one fella, compare notes and whatnot, and he talked to somebody else. And so we have a little roundhouse going on the email. And I think you're afraid of psychosomatic problems or something. The three of them said, I don't feel good, the fourth would, And, but I go busting into 9E at the Yawkey Center with Mary, and when I see people depressed and I see them sitting there the way I was back in December, I do my best to cheer them up. I announce how lucky we are, and sometimes I go a little overboard. Wish I had this cancer years ago. I never felt better. That doesn't go over so well with some. But really, pretty soon, instead of a silent waiting room, here's a woman hiking up her skirt, showing you where her first one was, and these kind of things. And we all share, and I think it's therapeutic. But it's against the rules, so.
Any side effects?
Yes, I'd say my first one, I went 64 days. I told Dr. Lawrence at Massachusetts General, I said, listen, I came of age in the 60s, and give me drugs like Rasputin, goose the dosage, come on, And I didn't think I was going to have any side effects. I was believing my own press release, and you get it. I call it a real bad hangover, except you got all your money and you can remember everything. And, so that was after 64 days. You got the headache, a little nausea, not bad. And I did have the sweats and the shakes on the first one only. And then I think I went 70 days. And then I had another one, but it wasn't as bad. And then I had the third one, another couple of months, and no rashes. Some guys have had rashes, and some guys have had bad fevers. I got a little one. He told me to call if it got over 101, Dr. Lawrence at a special number, and I never did call. But they take you off the BRAF. They keep you on the MEC, and they take you off the BRAF for 48 hours, and then you go back to full dose, and it's gone. It vanishes. And was it the fourth one I had not that long ago? Maybe about, well, I guess it is a couple of months. I went right through it. I didn't call Boston and tell them. Because it wasn't as bad. It was more of a headache than anything else. So I continued full dosage. And after a day and a half, it vanished. So that's, look how little you ask and look what you get. And so, and then they shrunk. The other reason I have a lot of hope is by February, I think that was my first scans post-treatment, post-participant. They treat me like a superior patient, but they call me a participant, or you guys call me a participant, and not a patient, which is fine, whatever you want to call me, just keep those drugs coming. And so they took the scans, and most of the marbles had either disappeared or shrunk. And the big guy in my upper lobe, it was about half size. And then 2 more months, another PT MRI or PET. And now it was a little like the size of a pea with a comma on it. And it won't change. Each time I go back, I'm going back the 21st, I'll get into that contraption. And I think it'll be the same. I mean, I don't know. But Dr. Lawrence said it could even be scar tissue because I did cough up some blood. And it had eaten into my lungs. And so that's where I am. I mean, I'm NED as far as 4 of my 5 lobes, and I have a suspected. But to find out whether or not it's scar tissue or still a tumor, you got to put that needle through your. I said I'm very interested in this melanoma, but not that interested. And that was fine with them. I signed off on your papers. No. Said, would you go through another biopsy? But I told Dr. Lawrence, if he asked me, I would do it. But that's the end of it. I mean, as far as where I am today.
So you're more than a year into it?
I am. I think
Still
I'm
taking your pills?
Oh, and we go back every 28 days. You guys are on a Mayan calendar. And really, they have 13 months at 28 days, the old Mayans. And so we go back there every 28 days. For a while, I had to go back every week, because they wanted to see if there was terrible adverse reactions. And there was nothing. So we'd fly home. And, we'd wake up in the dark, and if I didn't step on the dog, I knew I was in Boston,
So I'll make one comment, maybe a little personal, but I can't help but notice that you're a man of the 60s there with your ponytail. Or?
Actually, I had short hair most all of my life. And when I saw what had happened, I don't know, it just came to me. I wish it would come to me earlier to be bigger than a shaving brush. But I wanted to wear a symbol that said, the new day has already dawned. The future is here in the present, and I'm not losing my hair like my friends with chemotherapy. I'm not being weakened and fatigued and constantly sick for a week every month or whatever. I'm me. I'm a secular resurrection as far as I can figure it out. I really...
So just in closing, could I just... Oh my gosh. This happened to me at the FDA also. Is there anything that you want to offer? In our audience are actually the scientists who helped discover these molecules, who helped develop these molecules. Any message or anything you want to communicate to them, or what you expect or want from us?
More of the same as far as the latter part. And the former, I realized that there's one very special guest here. And I ask a lot of questions, and I talk to a lot of people, and I can go anywhere in the Yawkey Center except the 7th floor in the infusion chambers and carols where I see young children. And I've come to find out that people of your specialty, Doctor, routinely when they meet a wall and their patient's dying, routinely send them in, or at least recommend and give them the choice to try a human trial. And in Colorado, one of my mountain climbing buddies works for the Gazette. If you Googled Murphy melanoma and Gazette, the article had come up. And because of that article, I'm getting calls, and fourth stagers call me a lot. And I tell them about human trials, and they've never heard of it. And I think it's the soft underbelly of oncology that adults are not being referred to human trials by their physicians, their oncologists. From what I can see, the great percentage of people that are in human trials, my own cohorts, how did you get here? My sister did some research, you know. My friend told me about this. I read an article in the New York Times. That's how they got into human trials. Their doctors didn't put them in the door. And I don't know how much time I have left, but I feel more normal. A normal person doesn't know when you're going to die, and I was abnormal for quite a while. And because I did know, or pretty close. And with that time, I'd like to beat the drum for the right. And I hope it's exposed more and more, and that at oncological conventions and whatnot, a growing scandal. I want to start it, you know, if somebody else doesn't. But other than that, my feeling is overwhelming gratitude. There's no way to thank you all, and there's no way to tell you how my heart beats in excitement to come here and to thank you and to let you know that you might think you're making molecules and pills and whatnot, but what you're making is me. What good are all those pills unless you could take a person like I was and turn me into who I am today? Now, I'm not saying I'm worth $1 billion or whatever you spent, but this is what you get. I'm your end product.
John, on that note, I want to thank you. Thank you for and inspire us with your words.